Hi there, my name is Dr. Doctor, and today we're going to discuss asthma. Now, many of you may not realize how common asthma really is, but what is asthma? Asthma is a chronic lung disease that inflames and narrows the airways. When mucus around the airways tightens, it narrows the airways, causing less air to flow into the lungs, and swelling can make it even more narrow. Cells in the airway can produce an abundance of a thing called mucus. Mucus is a sticky liquid that can further narrow the airways more than the average airway. To know if you're in danger of having asthma, some of the symptoms are coughing, wheezing, shortness of breath, chest tightness, along with chest pain and pressure. Now, some of these symptoms are very mild and will go away for a little while with no treatment. Otherwise, they can be severe and abundance of symptoms occur and are known as flare-ups that can be life-threatening. Now, because asthma is long-term, there are some difficulties that go with it, like frequent attacks, easier to get sick, long use of medication can cause high cholesterol and osteoporosis. Several asthma attacks can cause damage to the bronchial tubes, and it's not curable. To limit your chances of an asthma attack, you can simply control stress. Muscle tension and shallow breathing encourage an asthma attack. Practice relaxation techniques like yoga or other relaxing activities. Avoid what triggers your asthma, like smoke, gasoline, perfume, air pollution. When exercising, know your limits for your lungs. To know your triggers, take a mental note, or write down what your surroundings were, or what you were doing right before your asthma started to kick in. Thank you, Dr.
Give me the news, I got a bad case of loving you. No pill's gonna cure my ill, I got a bad case.
I would say definitely cats and dogs would trigger a lot of my asthma, and also cold weather and running is also another thing that gets my triggers going. I use an inhaler and a nebulizer, but I really only use it when I really need it. I kind of just deal with it. I mean, I go through my daily life and use my medication when I need it. I just live my normal life. No, not really. I mean, I just go with the flow of life. I mean, it doesn't have really affected me at all. This one time I picked up a rabbit and my eyes started to puff up really bad and my asthma kicked in. But this one time it was really bad and I woke up in the middle of the night and I couldn't hardly even breathe. It was pretty scary. Just when I'm wheezing and when I can't breathe in the middle of the night, really. My aunt and niece have it, but no one in my immediate family has it. So. Let me think about this. When I can't breathe?